Hello, my geniuses. Welcome to another lecture series today. So, great science tutor Lorenzo, and I'll be talking about the Faradic current. So, the Faradic current is under the electrotherapy playlist. So, we have a electrotherapy playlist where you can watch all electrotherapy modalities and you understand them very well. So today, if you are just joining me, just make sure to subscribe or turn on your post notification button so that anytime I drop any video, you'll be sure to be notified. If you want me to make a video for you, drop it down in the comment section. I just promise I'll make that video for you. So this is the first on in the electrotherapy playlist, because in the electrotherapy unit we have various modalities we use to help in treatment, especially in people that are physiotherapy students and maybe patient is coming away from surgery, or a paralyzed patient, or patient that has any underlying conditions and you want to improve their muscle function, you want to reduce pain, or you want to reduce so many stuff, so you use electrotherapy modalities. So today we'll be starting on with the Faradic current. So now, first of all, before we move on, we have to know that in electrotherapy, we are using electrotherapy, using electricity, but not high electricity, using low electricity. I get him now to provide treatment. Low electricity to provide treatment. So since we know that we have the low frequency current, we have the medium frequency current, we have the high frequency current. So, but here we're starting with the low frequency current. Low frequency current modalities are the Faradic current, and you have the TENS, you have the so many currents that come. You have the iontophoresis, you have so many low frequency currents, and we'll also do the medium frequency current for the high frequency current. So first off, we'll start with the introduction to the Faradic current. In the Faradic current, first of all, you have to mark something. It is the low frequency current. One, it is a low frequency current, and also it is an interrupted electrical current. One, low frequency current and interrupted electrical current. So interrupted means that across time it can be interrupted, so it's not allowed to go for a long time. So since it's interrupted, so it is an AC current. So since it's an AC current, it is an interrupted current, which means it's not like a DC current that is a type of current that moves over with time. So it's an AC current that splits with time. Maybe if you on it for a particular time, it stops. You on it for another time, you get. So first of all, it's a low frequency current. Two, it is an interrupted electric current, which means it can be interrupted with time. You get it now. So first one, low frequency. Two, interrupted electric current, used specifically in innervated muscles. So innervated muscles is in one, low frequency current. Two, can be interrupted. Three, it is used in innervated peripheral muscles. So it could be used on the muscles that is already innervated on peripheral nerves. So one, are you getting that? So key point, always remember, when you remember Faradic current is a type of low frequency current, because I told you that there are low frequency current, there's medium frequency current, and there's a high frequency current. I get it now. And electrotherapy is using electricity to provide therapy to patients, to promote healing and reducing pain, increasing joint movement, increasing muscles, increasing mobility. You get it now. So since we have known that it is commonly in physiotherapy, so it is common in physiotherapy using muscle strengthening. I get it now. Muscle strengthening. Two, it is used in muscle re-education. It is used to prevent muscle wasting and improve circulation. So you only use a Faradic current when you see that the muscles are already innervated, which means the neuromuscular transmission is there. It's not that the muscle doesn't have neuromuscular transmission, or it is denervated, which means there is no communication between the brain and the muscle at all. So when you see like that, you know that you are not using a Faradic current. So you only use a Faradic current when you know that there's a transmission in that muscle. Are you getting now? So the muscle is already innervated, but the muscle is weak. So since the muscle is weak, you now use a Faradic current. So it's used to strengthen the muscle. Are you getting now? Two, you already have muscle movement, but due to a particular trauma or due to a brain damage, you just have to reignite all those stuff again. That is used for muscle re-education, to reduce muscle wasting. In a lower motor neuron lesion, there's always muscle paralysis. Are you getting now? So a patient that is all just in bed, maybe coming from an SCI, which is a spinal cord injury, or any underlying MSK condition where you have stayed for bed immobilized, there will be muscle wasting. So what Faradic current do is to increase more motor unit, recruit many motor unit in order to increase contraction, so reducing muscle wasting. And as you are doing this now, remember there are muscular vessels, muscular arteries supplies muscles. So we have muscular arteries, we have elastic arteries. So muscular arteries supply muscles, and also veins to pass through muscles. So when you provide muscle contraction, when muscle begins to contract over time, what happens? It increases venous return. So it also helps to improve circulation. So the Faradic coils was named after Michael Faraday. Remember, the Michael Faraday is a father of electricity who contributed greatly to the study of electricity and electromagnetism. So in your high school or in your secondary school, you might have done electromagnetic induction, or you'll have done current electricity. So the pioneer of current electricity is Michael Faraday. So here we are using Michael Faraday's principle of electricity, where voltage is directly proportional to current. So when you increase current, you increase voltage when the resistance is constant. So that's what we are using to pioneer the Faraday current. So 1 is a low frequency current, 2 is an interrupted frequency current, which means it's using an AC current. AC because it's interrupted, but if it's uninterrupted, which means it's a direct current. Are you getting me? Follow me. Uninterrupted is a DC current, direct current. Interrupted current is an AC current. So it's using an innervated muscles or a peripheral nerve. So there must be neuronal activity, neuron to neuron transmission in the nerves, and there's the neuromuscular transmission in the muscle before you can even think about using Faraday current. Are you getting me now? So now the current is used mainly for motor nerves. That means the current is used for presynaptic motor neurons, which means the motor nerves must have a good neuronal transmission. There's no damage, the myelin sheath are intact, you could have good circulatory conduction, no issues with it. And innervated skeletal muscle, which is saying that the skeletal muscle should have good motor unit contribution, which means the motor unit there and the muscular system should have receptors whereby iron can bind to open up the iron gated channel for the influx of iron for contraction. And in Faraday current, there's production of visible muscle contractions. So now the next one here is the characteristics of Faraday current. Are you getting now? The characteristics of Faraday current. Number 1, we are talking about the waveform. Now the waveform is an interrupted asymmetrical, which means the crest and troughs are not equal. Interrupted, which is an AC current, interrupted asymmetrical biphasic waveform. So the biphasic waveform is that you can have the crest and the trough. There's a crest and a trough, which means as it is going up, it is also going down from the positive side to the negative side of the voltage. Are you getting me? So it has a positive side, it has a negative side, but it is not asymmetrical, which means there's no equal crest up and there's no equal trough. Are you getting me now? So it's an interrupted one. It stops in bursts or in pulses. So now interrupted asymmetrical means not equal wave and not equal trough and crest. And the next one is that it's biphasic. Biphasic means it's an alternating current. I get him now. And there's a sharp spike pulse that occurs because you want to achieve a higher frequency to produce maximum contraction. So the next is the frequency. The next is because we have talked about the waveform and we say it's a biphasic waveform and it is asymmetrical and it is interrupted. Are you getting that? And sometimes when you use a high frequency for a short pulse duration, what happens? You produce a sharp spike pulse. And why it's pulse is that it is interrupted. You can on it for a particular time and off it for a particular time. So in the frequency here now, the frequency is between 50 to 100 hertz. I get it now, 50 to 100 hertz. That is the frequency. But the most commonly one we use is 50 hertz. Are you getting me now? So that's for the frequency. Remember, high frequency but for a low pulse duration. So the next one is the duration. Now what is the pulse duration? I told you the pulse duration is short. It is approximately 0.1 to 1 millisecond. So it is very, very short. A short pulse duration. While the frequency is about 50 to 100 hertz for a low pulse duration of about 0.1 to 1 milliseconds. Now what is the intensity? Now you adjust the intensity. So the intensity is not a number. You have to adjust the intensity for the patient comfort and for you to see a visible contraction. So if you do not see a visible contraction, which means the intensity is already low. So 1, the intensity should be adjusted for the patient comfort You ask the patient, look at the patient's face until the patient produce a facial expression of it's okay, and also you see a contraction. If you do not see a contraction, which means the intensity is minimal. But one thing about is that the frequency should be between 50 to 100 hertz, and the pulse duration should be 0.1 to 1 milliseconds. The next is the short Faradic current. The short Faradic current. So we have talked about the waveform, we have talked about the frequency, we have talked about the pulse duration, we have talked about the intensity. So we are in the short Faradic current. So there's a surge component in that machine. So if you look at it, there's a surge component, and that is when you want to graduate the neuromuscular transmission. So you want to increase neuronal transmission to the muscle, so the muscle can also receive acetylcholine, open up the ion gated channel for contraction. So but why are you surging it? Why? The reason why you are surging it rhythmically, one, is to initiate natural muscle contraction. You don't want to do it a machine related muscle contraction. You just want to surge it in a way whereby the the body will initiate contraction on its own by now you stimulating the nerves, because when you use Faradic current, you are much more focused on the nerve. Are you getting me now? So when you are focused on the nerve, you are stimulating the nerve to increase circulatory conduction and to transmit information through the release of acetylcholine to the muscle. So when you are doing that, you are producing natural muscle contraction for the muscle to move on their own, not because of you stimulating them, and two, to reduce muscle fatigue. So because when you fire the muscle over time for a long time and the muscle is contracting, what happens? The muscle will get tired because you suck out all the ATP there. Are you getting that? So sucking out all the ATP, reducing the creatine there, that is all happen to give phosphate there. So when you do all this thing, the muscle will be weak. Are you getting that? So also you are initiating muscle contraction, reducing what? Muscle fatigue, and the surging should be between 1 to 10 seconds. The surging should be between 1 to 10 seconds. So in recapping now, the waveform should be what? Should be asymmetrical, interrupted. Waveform, asymmetrical, interrupted. Are you getting me now? Interrupted, biphasic, which means biphasic means that it should have a crest and a trough. Asymmetrical means the crest and the trough will not be equal, and also the distance between each wavelength will not be equal. Are you getting that? That is for the waveform. And also this sharp spike pulse, which means that when you initiate or start the muscle contraction, or you want to initiate the Faradic current action, what happens? It goes up, it attain a higher peak potential before coming down to a low peak potential. So it has to go up and come down. So the spike duration should be also be taken in consideration too. Frequencies between 50 to 100 hertz, commonly 50. Pulse duration very small, 0.1 to 1 milliseconds. Intensity should be specifically to the patient comfort and until you see a visible contraction. And when you are surging it, you have to surge between 1 to 10 seconds. Because why are you doing it? Because you want to produce a natural muscle contraction and you want to reduce muscle fatigue. So next one is the electrode placement. In the electrode placement, you have to place the electrode over the motor point, the muscle belly, and the nerve supplying it. Again, you have to place it on the motor point, muscle belly, and the nerve supplying it. So every muscle has their own motor point. Every muscle. Are you getting that? So you have to know the motor point of every muscle. So you are placing it on the motor point, you are placing it on the muscle belly, and you are placing it on the nerve supplies. Usually the origin, where the nerves is coming from. So now, what are the types of electrode placement? Number one, you have the bipolar method and you have the monopolar method. In the bipolar method, you have two electrodes. You have the active electrode and you have the indifferent electrode. Are you getting me now? So the active electrode and the indifferent electrode. So but both of them are placed on the muscle belly. This is a Faradic current. Are you getting me now? It's not like a TENS or other one whereby you place it on the origin of the nerve. No. Are you getting me? You place both of them on the muscle belly. Are you getting that? So naturally for bipolar placement, you are using it for small muscle and localized stimulation. You get it now? So remember, you have the active electrode, are you getting now? And you have the indifferent electrode. You get it now? So majorly some active electrodes are usually red and some indifferent electrodes are black. But this one you are seeing here, the active electrode is black while the indifferent electrode is red. You get it now? So but always know that if it is red, which means the active electrode, if it is red, it will be placed on the motor point, while the indifferent electrode will be placed distant to complete the circuit. Are you getting? But for bipolar placement, both of them will be placed on the muscle belly you are about to stimulate. So it's always used for small muscles and for localized stimulation. Now for monopolar placement, the active electrode will be placed on the motor point, while the indifferent electrode will be placed far away from the motor point. But for bipolar placement, both of them will be placed on the muscle you want to stimulate. But in monopolar placement, the active one will be placed on the motor point where you want to stimulate, and the indifferent electrode will be placed far away. You get it now? So it's used for selective muscle stimulation. So you want to pick out a specific muscle, and the muscle is not big. Are you getting it? Maybe the muscle is not big, but the bipolar placement not really is used for small muscle, but it can also be used for big muscle. So typographical error, the bipolar placement could be used for big muscles too, while the monopolar placement could be used for selective small muscles. So you want to innovate. Okay, now. So don't forget it. Bipolar, 2 of them on the muscle belly. Monopolar placement, 1 on the muscle belly, 1 distant away from the muscle belly. So the next one is the motor point. So what can you talk about as a motor point? A motor point is a point where a motor nerve enters into a muscle. Are you getting now? Or where a neuron, one single neuron, innervating the muscle fibers. Are you getting me? So you can say a neuron and a muscle fiber, or you can say it's a point where a motor nerve enters into a muscle to supply it. So that is what a motor point is: a neuron and a muscle fiber, or a nerve supplying a particular muscle fibers. So that point where the motor nerve is entering the muscle is called the motor point. It's the area of the maximum muscle excitability. So that point where the nerve enters into the muscle is called motor point, and is a point of maximum muscle excitability. Are you getting now? When you have proper motor point placement for the electrode, so when you place it on the motor point, what happens? It will produce a stronger contraction, and the patient will not have discomfort. Are you getting now? Stronger contraction, less discomfort if you place it on the motor point. So you have to know the motor point. So in subsequent video, I'll also do a video of motor point of all part of the body. So you get it now. So bipolar placement, monopolar placement, and the electrode must be placed on the motor point, on the muscle belly, and the nerve supplies, which is the motor nerve innervating the muscle. So the electrode size should be between 2 to 5, which is for small electrodes, 2 to 5 for smaller muscle, for medium muscle 5 to 8 centimeter, which is for moderate muscle. Then for large electrodes, which will be for large muscle, which will be 8 to 12 centimeters. So you have to know, it depends on the patient body size. Are you getting that? If the patient body size, and you know you are using it for a very large muscle, like your back, muscles of your back, or your calf muscles, or your thigh muscles, these are large muscles, and the patient has a very big, so you use a large electrode size. So for medium electrode size, based on your visual acuity, for the ones you feel that it is large, and for the ones you feel that it's small. So next one is, how can you prepare the patient? These are just simple stuff you can use to prepare the patient. Number 1, you have to clean the skin very well. Clean the skin very well. We call it skin toileting. Clean the skin to remove any part very well. So you have to remove oils. I get them, any oils. Patient is sweating, you have to clean that area, or any lotion. You have to also check for cut, wound, skin lesions where there's any underlying skin pathology in that area, because that could be a contraindication to using the modality. The next one you have to use you have to use a moist sponge pads if required. Are you getting that? So these are to prepare the patient very well for the use of the modality. So what is the method of application? The other one was preparing the patient. So how can you apply it? 1, if you are approaching the patient, you have to first explain the procedure to the patient. Explain the patient the risk involved, if there's risk there, the advantages to the procedure. You have to explain what is the usefulness of the procedure to the patient. Why are you doing it? Just to keep a good legal standpoint. Are you getting now? It's just to keep a good legal standpoint, because as a medic or as a therapist, you have to make sure the patient is aware of the risk and the usefulness and the disadvantages to the procedure. You have to tell the patient, and you have to explain each steps to the patient. Next, you have to have a good patient position. How can you position the patient? The patient has to be relaxed, comfortable, and properly supported. So if you are placing the patient on the supine line, you have to place the pillows on the proper places, like at the back of the neck. You have to place the pillow under the back, you have to place the pillow under the knee. Are you getting me now? So these are the places if you are placing the patient on supine, because the patient has to be what, comfortable. So you have to do a good starting position for it. So first one is to explain the procedure. Two, you have to properly position the patient. Are you getting me now? So the next one, you have to apply the skin toilet into the skin, clean the skin very well, like I said before. Clean the skin, remove excess oils and sweat, check for cuts and wounds, and you have to what, moist, using what, a moist what, sponge pad if required. So when you have done all this thing too, you have to now place the electrode now on the motor point. Place the electrode on the motor point. If it's a large muscle, you have to make sure the two of them, you have to use a bipolar placement, placing them on that place directly. If it's a small muscle, you can use one electrode, the active electrodes, put it there and place the other electrode on somewhere. You have to adjust the intensity in the sun. That now when you start opening, going to the intensity part, look at it on the electrotherapy modality. So when you are turning the intensity, you have to turn the intensity enough to produce a contraction, and when it's producing a visible contraction, you also have to look at the patient's face or ask the patient whether the patient is comfortable and whether the patient is feeling anything. So when the patient tells you that okay, he's feeling something and it's not comfortable, you have to reduce the frequency. Are you getting me? So you have to apply surges in a way that you have to have an on time, which is a contraction time, and an off time, which is a non-contraction time or a relaxation time. So apply surges. Go to that place where there's a surge. You can see it on your screen now. You go to that place where there's a surge. Then when you go to that place, you turn it to your first one, which is your on time, which is, let's say, 3 seconds for contraction and for 5 seconds for what, relaxation. Or you can do 30 seconds for contraction, 50 seconds for relaxation, which means the contraction time should be what, lower than the relaxation time. So the patient has to be more relaxed in the relaxation time than the more contract. If not, there will be muscle fatigue. You get it now? So what are you looking for? You are looking for smooth contraction, and when the patient is contraction, so as the patient is doing it too, the patient could also be applying some, okay, after being relaxed, the patient can also try to move that limb too in response to that motion, so that it could be easier and it could reduce time for what, it could promote time for recovery. So it could also be used to promote time for recovery too. You get it now? So you have to monitor the patient, stay there, because you don't leave. Because another wrong thing about this procedure, it could promote anything. There could be skin burn, there could be overstimulation and fatigue, there could be drop in blood pressure, or there could be spike in blood pressure, because when you are contracting the muscle, you are increasing venous return, and that could be bad. So you have to monitor the patient all through. So you observe for discomfort, excessive pain, skin irritation, and muscle fatigue. So you'll be there. So the next one, now you have to end the treatment. So when you end the treatment, you have to reduce the intensity. You have to reduce the intensity and what, gradually off the machine. So in that machine now, what can you see now? You can have, you are seeing a frequency there. So you see a frequency which I tell you should be 50 to 100. You have an intensity, minimum and maximum, not specific, based on what the patient can take. So you can also see a surge. I told you that the surge is graduated between 0 to about 20 seconds. So you have to surge it in a way to have an on time and an off time. Are you getting that? So you surge it. The first surge is from 0 to 20, and the second surge is from 1 to 10. So you have to have good surge frequency. Are you getting that? So, and the pulse duration should be on the timer. The pulse duration should be between what, 0.1 to 1 milliseconds. So you see the machine. So you know, now you see the power button there. So the power button there is where you use to on and off the machine. And also you have an input where you put the input and the output, where you use to connect your electrodes which you use for the procedure. So always remember, this is just a Faradic current modality. So safety precaution. What are the safety precautions you should have? Check all the connection before starting. You have to check all the connection before starting. Just make sure that there's no live wire there, because there could be risk of electrocution, even though you are just using a low frequency current, because remember, it will always be connected to an electricity. 2, you have to monitor the patient throughout the experiment, or throughout the treatment rather. You have to monitor the patient throughout the treatment to avoid maybe fatigue, skin irritation, increase in muscle contraction that could cause spasms, excessive pain. You have to monitor. Ensure patient comfort at all times. If the patient is feeling the contraction is so much, reduce it. You have to stop treatment if pain is excessively and discomforting. So you have to reduce it. So these are the mode of application and the safety precautions you must take. So what is the physiological effect to this treatment? The first one is the muscle contraction. So when you stimulate the nerve, so remember I say Faradic current, you stimulate the motor nerve. So when you stimulate the motor nerve, there will be increase in what? Neuromuscular transmission. And when there's increase in neuromuscular transmission, there will be increase in calcium, and calcium will cause contraction. So there will be muscle contraction when you are stimulating using a Faradic current. Are you getting now? So Faradic current produces motor nerve stimulation, and motor nerve stimulation produces what? Muscle contraction. I've said it already. So you can see this can also help you. Next one is muscle re-education. Are you getting now? So the muscle was already weak. Like I said, majorly we use it when the muscle power is about 1 or 2. So you only use a Faradic current when a muscle power is between 1 or 2. Not that the patient is paralyzed. If the patient is paralyzed, you don't use a Faradic current. So you might use an electrical muscle stimulator, which you call the EMS. So you cannot use a Faradic current. So muscle power 1 or 2. So the patient is having what? Paresis, which means there's muscle weakness, maybe post surgery, maybe post any issue. It could be any pathology that is wrong with the muscle. So it could help with strain muscle. It could help with strain muscle weakness after injury or immobilization. So you are just recruiting motor fibers. It's not that the muscle is already active, but you just need more electric joules or much more intensity to make it start contracting. Are you getting that? So weak muscle, and when you use Faradic current on weak muscle, there could be improved muscle function. Why? Because you have to recruit more motor units. The first one is provide muscle contraction. 2, muscle re-education for already weak muscle, not in denervated muscle but innervated muscle. Prevent muscle what? Atrophy. We don't want muscle atrophy because when a patient doesn't use the limb, there could be disused atrophy, there could be disused muscle wasting. The muscle will start wasting. Are you getting now? But what Faradic current does is that, do you know what? It builds more motor units. So it recruits more motor fibers, bring more motor fibers to that place, engage in what we call proteogenesis, stimulate growth factors to produce muscles, and these muscles can be bigger. Because in atrophy, when you don't use it, when you don't even perform what? Mobility, what happens? The muscle will start wasting and the muscle bulk will reduce. So there's also assessment for you to know when the muscle is atrophied. So but that will be under our assessment. Now the next one is that it helps to increase blood circulation. I've said it. Repeated contraction increases what? Venous return. Why? Because blood vessels passes through muscles, and especially the veins, and when they pass through the muscle, what happens? They go from superficial veins to deep veins, and from deep veins back to the heart. So when you increase muscle contraction, what happens? It provides increase in venous return, and increase in venous return increases heart rate, increase cardiac output, and there's increase in blood water circulation. Now there's also increase in lymphatic drainage. Are you getting that? Increase in lymphatic drainage is when blood from arteries enter into what? Muscle tissues, what happens? They leave back to the veins or to the lymphatic system. So what happens? So when there's edema, which is pathological accumulation of fluid in the interstitial space. So in edema, what happens? Edema is when fluid is collected in the tissues, and especially in the muscle tissues. So when you increase contractions using a Faradic current, you could create a vibration to the muscle, sending out the liquid back into the lymphatic system or into the veins. Are you getting that? So it increases lymphatic drainage and reduce edema. Also, when you are stimulating sensory nerves, what you make the your primary somatosensory area of the brain to be aware that the nerves are very functional, especially in patients that have impaired sensory function. If they have impaired sensory function, when you continue stimulating the motor point around that area, it stimulates surrounding what? Nerve endings, which is the nociceptors, also the Pecinial corpuscle, the Marcinia corpuscle. It stimulates all the nerves across that area and make them active. That is why if you still overstimulate, the pain areas will be sensitized, the pain receptors will be sensitized, and they'll be sent to the brain. So also the patient will feel it, which means you are also stimulating what? Touch receptors. So there's so many receptors that are stimulated when you are using a Faradic current. So next is, what are the indications? So why do you want to use this modality? So what is the indications of this modality? Before you use this modality, you have to, one, the patient has to have muscle weakness. The patient has to have muscle weakness. So you use it for muscle re-education, muscle weakness, paralysis. Then you use it for muscle re-education, which means the muscle power should be about 1 to 2. So if the muscle power is about 1 to 2, is a good indication you can use it because it helps to recruit more motor units. Prevent muscle wasting, we have talked about it. You use it for post immobilization weakness after a surgery. Maybe patient just went through a knee surgery or a tendon transfer or an ankle surgery or any surgery, so you could use it because the patient is immobilized. The next one, peripheral nerve injury. So a patient could have a peripheral nerve injury like sciatic nerve damage. It could be a common peroneal nerve injury, it could be a tibia injury, it could be a radial injury, any injury. Foot drop, maybe a patient is having damage to the common peroneal nerve or the sciatic nerve, so you can use it for foot drop. You can also use it in Bell palsy when the facial nerve is damaged above the styloid process. It could be a pathogenic infection. It could be a trauma to that area, but not from the origin. Because if there is a lesion in the facial nucleus in the pons, you also use it because you can also use for facial muscle stimulation. Because in facial nerve palsy, what happens, there's an injury to the motor nucleus of facial nerve from the pons. But if it's a Bell palsy, that means the facial nerve have left the skull already to the stylomuscular foramen, and there's an issue causing damage to the terminal branches of the facial nerve. So there will be complete paralysis of half of the face. When Bell's palsy, in facial nerve palsy, what happens, there's only an issue to only the lower quadrant, which is just the mouth. There will just be drooling, but the forehead and the eyes will be fine. I get it. So Bell palsy, complete facial nerve paralysis of half of the face. But in facial nerve palsy, is just the lower part, which is the mouth. You can use it for facial muscle stimulation. You can use it to treat Bell palsy. For patients that have poor circulation, and you can also use it for edema, especially leaf edema. What are the contraindications? One, don't use for a patient with pacemaker, because patient placed on pacemaker, they have irregular or cardiac activity, so they use a pacemaker to help regulate the cardiac activity. Remember, we have the conducting fibers, which is the SA node, AV node, bundle of His, and Purkinje fibers. So with patients with irregular cardiac conduction, then you use a pacemaker. So don't put it over the heart. Even don't use the patient with that issue because it could malfunction and damage the pacemaker or cause irregular cardiac activity. Don't use it for patients with malignancy, patient with underlying maybe cancer or tumor. Why? Because it could increase the spread of that, and it could increase abnormal or proliferations of cells. Don't use it in a patient with thrombosis, a patient with already a thrombus formation in any part of the body, or maybe the patient is hypercoagulable. Don't use it for the patient because it could dislodge the clot and cause thrombosis. It could travel to the brain and cause some other conditions that you don't want. The next one is that you don't use it for patients with active bleeding because it can cause muscle contraction, can cause a lot of bleeding continuously. So you don't use it for patients like that. A severe cardiac condition like heart failure, like any other condition, it could be heart failure, it could be valve issue, it could be cardiac arrest, which is myocardial infarction. You don't use it for the patient. Don't use it for patient that is pregnant, especially over the abdomen, because it could induce uterine contraction causing preterm labor. So you don't use it for patients that is pregnant over the abdominal area because you don't want to bring out a baby that is not yet ripe to come outside. Don't use it for patients over an open wound. Why? Because it will cause an even distribution of the current around that area, and it's not nice. Don't use it for patients with skin infection because it could increase inflammation and causes the skin infection to even spread more. So don't use it for patients with impaired sensation. Before you even use a Faradic current, the patient has to be innervated. The nerve has to be working. You have to do a sensory test and a motor test to make sure that the patient is feeling. So you don't use it for patients that do not have sensory impairment. Don't use it. Patient that already has epilepsy or any form of seizures, don't use it because it could stimulate the brain excessively, causing excessive neural conduction, even causing more seizures, so which you cannot control because you are not qualified for. And even though it could cause more neurological damage. You don't use it for patients with acute inflammation. No, don't use it because this is not what you use for acute inflammation. You use cryotherapy, so you don't use it because it could prolong the inflammation the more. The next is the precautions. What are the precautions you have to note when you are using Faradic current. Number one, you have to be cautious when you are using for elderly people, for children and patients with sensitive skin, because it could cause hyperactivity, or it could damage something that wasn't damaged before the patient come. And you have to caution when you are using it with patients that have reduced sensation also. And you should always test the skin first to make sure that the skin has sensation first. You have to do a sensation test first, maybe using a pinprick sensation, or you want to use a deep sensation, just to make sure that the patient is feeling. Now you have to inspect the electrode very well. Maybe the electrode, there's no wire that is exposed, which will cause electrocution to the patient, and you have to monitor the patient carefully. So I hope it all made sense to you and you have understood everything we have talked about the Faraday current. So hope you understand, hope you get it, and hope you have stayed with me to the end of this video. Always know that if you are a new student joining us, you have to make sure to subscribe and turn on your post notification button, so anytime I drop any video you'll be sure to be notified. If you want me to make a video for you, make sure to drop it down in the comment section. I promise you I'll make that video solely for you. And also make sure you push it to other students that will need this very well. Push it to them, make sure they enjoy it, and if they enjoy, give us a feedback in the comment section always. Bye bye.